And I want to introduce our speakers from Bristol. As you'll have seen from the programme, the format for today is to follow our key presentations with some practice examples. And our first of those picks up on one of the topics referred to by James in relation to the hospital discharge and how the key to successful discharge often depends on the link to housing and particularly home adaptations. So I'm really pleased to introduce colleagues from Bristol to talk us through their experience. And we have Kevin Snowball from WEcare Home Improvements, Laura Thacker from AgeUK, and they will be joined and interviewed by Carol Watson, the Head of Commissioning for Bristol City Council's Adult Social Care Department. So Carol, I think I'm handing over to you.
Hi, thank you. Gosh, as a Head of Adult Care Commissioning with a personal and professional passion about extra care housing, that was amazing, James. Thank you so much. Laura and Kevin, can we just start by setting out for everybody else in the conference a little bit about how each of your organisations was involved in the response in Bristol? Laura, can you talk a little bit about the work that AgeUK Bristol led?
So,
have we got Laura?
Oh, yeah, can you hear me?
Yes, we can.
Yeah, brilliant.
Okay.
Yeah.
I work for AgeUK Bristol and I run a programme called Bristol Ageing Better. So AgeUK Bristol is a network member of AgeUK. We provide specialist advice, information and support services for people over the age of 55, but we work in a collaborative way with lots of other voluntary organisations in the city. And one example of this is the Bristol Ageing Better programme, which is funded by the National Lottery. The funding has been £6 million for 6 years, and we're currently in our 6th year. So we use this funding to commission voluntary sector organisations rather than developing services for AgeUK Bristol itself. And so this kind of partnership working within the city was really designed to take different approaches to the problem of social isolation and loneliness in older people, testing ideas and improving service delivery from what we've learned. So over the last 5 years, we've obviously encouraged partnership working through this programme by commissioning projects as a way of sharing expertise and resources in the voluntary sector. And I think this approach really built trusted relationships across the voluntary sector, and this enabled us to form our response to COVID-19, which was the Support Hub. Do you want me to just say a bit more about the Support Hub, Carol?
Yeah, please do, Laura.
So the Support Hub began with 8 voluntary organisations and is now up to 32. AgeUK Bristol were asked by the initial 8 people to use the AgeUK Bristol phone number as a single point of access for older people to access services, and AgeUK Bristol coordinated the running of the Support Hub helpline. So this Support Hub is a collaborative approach to meet the needs of older people during the pandemic. As I say, it's a single point of access for not just older people, but also professionals as well. And it's providing practical support such as shopping, prescription collections and benefits advice, etc. Along with emotional support such as telephone counselling and befriending, and the social support, so different activities that people can do at home. And really the response to COVID-19 sped up processes that were already in motion, really. So at the start of the pandemic, we had been engaged in talks for months about how to enable multidisciplinary ways of working between health and the voluntary sector. And I think by the time we were a few weeks into the lockdown, we'd been pitched straight into collaborative working across sectors out of necessity. So this wasn't as difficult as we had originally thought, and everyone pooled resources in order to support people.
Thank you, Laura. Yes, that we have to get on and walk our talk aspect of COVID has kind of really sped things up, hasn't it, in Bristol? Kevin, do you want to come in and talk a bit more about the role of your organisation and how that developed even further during this period?
Yeah, sure. Paul did mention at the beginning that we might have internet problems, and I'm afraid my camera isn't working, so you just get my mugshot while I'm talking in the background. WEcare Home Improvements is a home improvement agency, and we're contracted and commissioned by Bristol City Council to provide a home improvement service. We do provide a full agency service with casework, technical officers, DFGs, handy person service, information and advice. So we're very fortunate that Bristol still financially supports such a broad breadth of services through a home improvement agency contract. And actually through this whole process, it's been quite interesting seeing which parts of our service was most required in order to respond to the crisis. In recent years, hospital discharge work has taken up a bigger proportion of our activity, both in terms of volume, but increasingly in terms of speed of response. And so actually when the COVID crisis struck and James was referring to 25,000 people needing to be taken out of hospital very, very quickly, we really thought our time had come, because we've been working on this for a number of years to integrate our service within health and social care into home first packages, discharge to assess, etc. Ironically, when the huge volume did actually take place towards the end of March, our service was largely bypassed, and I know this is not about blame, it's just this is what happened. But unfortunately, a lot of people were discharged to the wrong place or at home, and actually they weren't ready to be at home in the right way, and we're now picking up the pieces from that. But actually, after that initial surge at the end of March, our service then really kicked into being, and we're an important part now of what's called the Integrated Control Centre, which is being set up within Bristol, which is effectively like a triage point for hospital discharge, which includes health, social care, and ourselves. And it's coordinated by the community health provider and the Red Cross. And that's a really good example of relationships that were reasonably well established, but I wouldn't say truly embedded up until now. And the learning process of working together in the course of the last couple of months has really transformed both relationships and speed of response, so that everybody now does have a much better understanding of what each other does and where they fit in, so that actually at the end of it all, the person that's being discharged from hospital, which is the most important person in all of this, is actually getting a better service and a more responsive service and a more joined up service than they might have done hitherto. So I think that's really positive. I think the other thing that's worth sharing with colleagues is that one of the responses in the CCG, so for us we have Bristol, North Somerset and South Gloucestershire, 3 local authorities, all in the same CCG. What they did was they set up a VCSE support cell, as they called it, very quickly, which incorporated representatives from all of the local authorities. Carol, obviously you sit on that from Bristol, but it also incorporated colleagues from the CCG and the community health provider and a number of key infrastructure organisations, Red Cross and us included. And it's actually been quite interesting to see how that developed over time, because we were kind of welded together very quickly, if you like, not in the same room, all virtual relationships. Some of the people that I now know really well, I've never met before as part of this group. But it's been quite interesting to see how they developed from a sort of statutory point of view. My impression was that we were sort of invited in, but then told what to do to start with. But actually very quickly that changed, because information was being shared widely, data was being shared widely. Trust developed on the basis of basically we need to trust you because we need to get this stuff done. but actually that has very quickly developed into proper trust, as in we all have roles to play in this. And actually we need to rely on each other to do it properly. And that's led to much more co-creation and design of what we do, as opposed to sort of top-down instructions. And I think that's been very encouraging.
Thank you, Kevin. I think what was interesting about that was there'd been a lot of pre-work, hadn't there, before COVID across BNSSG about new ways of working with the third sector, and we've got a Healthier Communities group. And then there was this blip, wasn't there? We went into emergency and there was this blip where nobody behaved in any of the ways that we had all been talking about behaving, and then went, whoa, hang on a minute, we've got to get back together and work in the ways that we'd already set up. And relationships are really important in that, aren't they? Between obviously local government and health, between us and the voluntary sector, but also I think between voluntary sector organisations. And Laura, do you want to say a little bit about the work, really important work, that Bristol AgeUK did in trying to bring together organisations, and the importance of relationships and the complexity, which is, you know, part of one of the most positive things about the voluntary sector. It's not one thing, is it? Do you want to say a bit about that?
Yeah, sure. Yeah, I think what you were saying about the VCSE cell, how it did take a while to get going, but then when it did, it's working really well. I think you're right in terms of the complexity of the voluntary sector as well, because there was a lack of understanding about what the voluntary sector could offer. The focus initially was on place-based communities, and it was so firmly on this, that the importance of engaging with communities of interest, especially older people and mental health, was lost. And for that reason, specialist skills and knowledge weren't accessed as well as they could have been from the outset. And a number of organisations, including AgeUK Bristol and others who were involved in the support hub, were trying to offer their services but couldn't necessarily find a way to connect. As I say, I think there was a lack of understanding about the difference between community action and voluntary sector organisation, and groups who were keen to recruit volunteers quickly and were offering help with shopping and pension collection, befriending, etc. But they didn't necessarily have DBS checks or guidance or support for volunteers, which you would necessarily get with the voluntary sector. And at the same time, voluntary organisations where they had those checks, they weren't being enlisted to help. And I would say it was due to several specialist voluntary organisations within the support hub who we felt we were kind of out of the picture. We felt compelled to come together to form the hub. We wanted to offer a clear route into safe and well-established services for older people, knowing that there would be confusion for this group of people in a time of crisis. And this initial approach does risk destabilising the voluntary sector, I think, particularly because community action groups could seem like a cheaper option, but they aren't necessarily providing the same service, and particularly that there might be an oversight for support for volunteers. Some voluntary sector organisations did actually have to furlough staff because they weren't being used by the statutory sector. So I would also say with AgeUK Bristol, there were some issues around things like prescription collection. So pharmacies supplying medication refused to enlist the help of NHS volunteers. So they were putting pressure instead on the voluntary sector. With AgeUK Bristol, we were able to support other sectors. So we had set up a telephone befriending service many years ago, which you cannot find funding for nowadays. And so we kind of created those services back up again. We supported the council by giving our manual for this befriending service, and also supported other voluntary sector services to ensure that they could provide befriending services at this time.
Thank you, Laura. I'm looking at Neil a little bit because I think the timings have already gone a bit awry. So, you know, I think before we finish up, I think there is something about how, okay, we went into emergency, we had a bit of blip, and then we all started to behave the way we'd always planned to behave. But obviously for all of us, we had to stop doing some things. We all put some things on hand. Ironically, for us in Bristol, one of the things that had to go on hold slightly was our Better Lives at Home vision in terms of developing more extra housing. That we're picking that up again now. I wonder whether we should go back to Kevin first. And Kevin, can you just tell us a little bit about then the work that's gone on hold that you're now wanting, really importantly, to pick up, and the impact of some of that, some of the things that we haven't been able to do over the last few months?
Yeah, sure. I think this relates back to the sort of the principal raison d'etre for a home improvement agency is to help people to live independently in their own home, and to be able to still contribute and be part of their communities. That can be a variety of things, from very small adaptations like grab rails, banisters, key safes, and so on, through to disabled facilities grant work and large adaptations. And I've seen lots of chat about, you know, what we need to do to regenerate housing, because most people, it's not all about building new houses. Most people are already living in the houses. They're already built, that are going to be around in 2050. So we need to do more about keeping them in their own homes. And I think the frustrating thing over the last 3 months is that a lot of the preventative work, which is so vital that we do, has had to stop because we haven't been allowed into people's homes, except for what were classed as emergencies or essential work. And a lot of what an HIA does is fairly low level preventative work. And over the course of 3 months, quite a lot of that is built up. And we're now seeing a huge increase in people wanting us to go in and do some work. Secondly, probably understandably, shielded people were right at the top of the risk list, and so we couldn't go and help shielded people. But actually, they're very often the most vulnerable that need help. And I think the changes there that the government have announced over the last couple of days will have a big impact quite quickly, because there'll be a lot of work to do from that point of view. But one of the things that I think is worth mentioning is through this whole situation, loss of income, both for local authorities, as you will all well know, and particularly for VCSD organisations like my own, has been potentially catastrophic. One of the things that the charity sector was encouraged to do a number of years ago was take control of income generation, diversify sources of income, and not just be reliant on grants and so on. And we absolutely did that. And 50% of our income is self-generated, and of course that dried up almost overnight. So business recovery is going to be hugely important, as well as being able to help the wider system recover. But I really do think, and I would say this, wouldn't I? You know, the place of the home has been shown to be so important through this whole pandemic, and we absolutely have to focus on making people helping people to be more resilient, and for communities to be more resilient. And my greatest worry is that with local authorities and central government being so challenged financially out of all of this, the first thing that usually goes in these circumstances is preventative work. And it's absolutely the preventative work, housing regeneration, dealing with those inequalities that will make us better off in the future. So I really do think we need to address that.
Yes, I totally agree, Kevin. And you know, for myself as a commissioner, for my director, those are difficult discussions that we have to have all the time. And I think you've touched on a really important irony there. So pre-COVID, and we're just picking up again now in Bristol, we've been doing a lot of work with some of our locality-based anchor organisations who act as community businesses, encouraging them to come into the social care space so that some of our big spend works through them. And actually some of them, because they have learnt to be so resilient and sustainable, have been worse hit. Because if you're a local organisation and you're making your money by childcare, and that all went down in COVID. So I think, you know, it's all a massive and growing issue, isn't it? And as you say, the demand hasn't gone away. The demand has actually increased, hasn't it? And that's some of the challenge we're going to face.